Now, COVID-19 has wreaked havoc in the lives of millions of South Africans in many different ways, such as not having enough food and access to basic services. The last 24 hours have been remarkable as the Gift of the Givers teams engage government teams in a collaborative effort to achieve a meaningful life for people through what they've described as some of the simplest interventions. Dr. Imtiaz Sooliman is with the Gift of the Givers. He speaks to us now. Dr. Sooliman, good evening and thanks for your time. Before we get into some of the interventions that you have been launching over this weekend and will continue to do throughout the week, let's just talk about where we are in terms of the kind of relief efforts that your organization is having to administer in this moment.
Good evening, Kathy. We've been administering this kind of relief for several months now, from even before lockdown. But during lockdown itself, of course, the need became much greater, where there was an additional requirement, in addition to hunger, there was hunger in the country, which we were helping. But of course, hunger became far more pronounced with the lockdown and the economic situation with job losses of over 6 million. Added to that, we were busy with, and are still busy, with dealing with the drought, especially in the Eastern Cape. It's since 2015. And with each day, it gets worse. And in addition to that, now during COVID, the huge demand from medical facilities for protective materials, oxygens, support isolation units, pulse oximeters, non-contact thermometers, and everything related to COVID-19 in a hospital setting. So those are the three key areas we've been dealing with. And a fourth area, as in addition, is providing a fodder for animals that are very hungry and dying because of the situation of the drought.
Let's talk about COVID-19 first, because as we're speaking tonight, the province has said that they are experiencing a second surge of the virus in the Eastern Cape. What does that mean for organizations such as yourselves, Dr. Sooliman? And I'm interested to know if there are particular problems that you have identified that you think, if they're better dealt with, perhaps you could see a better response to the wave of infections this time round.
Well, the infection wave we can't control. I mean, that's not in our hands. That's depending on the responsibility of people. On the one side, it's people, who have mass gatherings, but you can't blame the people who catch it from those people who went to the mass gatherings. So on the one side, you have the people who are irresponsible. And on the other side, you have people who have nothing to do with the responsibility. They are just unfortunate victims of the situation. Now, with both cases, you have to be ready for them. And readiness means having hospitals that are ready to receive the patients coming. Of course, those that are mildly affected, it doesn't matter. The problem is those who require oxygen and who become critically ill. So it requires certain ingredients which all the hospitals don't have. There's still a huge shortage of PPEs. In spite of all the scandals that we spoke about, there is a huge shortage of PPEs. In the Eastern Cape, over 40 hospitals have called us desperately seeking PPEs. We've delivered to 18 already, and we're still on the roll providing to the other 20. The second and more urgent matter is, even though they're putting up beds and beds are putting up, it's of no use because there's no staff. There's a huge shortage of staff to support COVID-19 patients. The existing staff are burnt out, they've had enough, they're demoralized, they're depressed, they're scared, and they just cannot cope. And just when they thought they're getting out of the first wave, they suddenly hit with a second wave. We're not calling it a second wave yet, but a second outbreak of virus, especially in the Eastern Cape, which seems to be much stronger, faster coming, bigger numbers than the first one.
It's absolutely devastating. And at the same time, we take a look at communities like Makana, which you've been working very closely with, that are having to deal with the drought, and some interventions that you have been planning for the Graaff-Reinet area as well.
Yes, we've been involved in many areas for the drought. Remember, it's been said, wash your hands. What are you going to wash with if there's no water? Also, the water is required for medication. Strangely enough, a lot of clinic sisters call us from different areas and said, look, our patients are not getting better. And we realize they're not taking their medication because there's no water to take medication. So we had been involved in Makanda from 2019. We had drilled 15 boreholes there, and most of the town is surviving on those boreholes. In Graaff-Reinet, we put 9, and we just drilled another 3 to make it 12. A place called Club Plat, not far from Graaff-Reinet, had no water at all. The water had shut down. We virtually have saved that town a few weeks ago by pumping out 2 million liters of water a day. And there I must say it's a fantastic cooperation between Beyers Nudia Municipality and ourselves, where we're pumping water into the municipality system, which is going around to the rest of the town. It's excellent. Yesterday, on Friday, we were in Pedi. There again, where the municipality called us, they had drilled 32 balls, or they had given a contract. 32 balls were drilled, and not a drop of water was found. We went in on Monday. We've drilled 4 balls, all successful, and existing balls are from 1974 that were disused. We're starting to open them up so people can have water, and we delivered 1,000 food parcels. In Adelaide, again, we drilled 8 boreholes last year, but because of the electricity problems and the water is running out in the town, we drilled another 4, and we're drilling 2 more this week. So we're involved. There's requirements in Fort Beaufort, in Alice, in Amtata, and in Makanda again, more in Graaff-Reinet, Kromi, Kala. There's just requirements everywhere, and we're trying to do the best we can.
Dr. Sooliman, one of the things that I've also seen is that alongside just the immediate access to water that you're providing, is you're assisting communities with being able to grow their own food, which I would assume is a longer term intervention when it comes to dealing with the hunger and the poverty situation.
Yes, Kathy, we're forced to do that. There's only so much food parcels you can give. And whilst we were busy in Graaff-Reinet, the idea came up, most of our balls are in schools. So we told the hydrologist, because we saw in one of the school, there was an attempt, a school called Nursing Street Primary. Unfortunately, the day we had the function, 2 days later, the principal of that school passed on because of COVID. And we all respects to his family and to the man who passed on. But in that school, there was a small vegetable garden. And the idea came, we have boreholes in virtually every school in Graaff-Reinet. Let's use it as a prototype. Let's send water out from the balls, make kids environmental ambassadors, which we did. 110 students from 10 schools made them environmental ambassadors. The seeds were given, the TLB was brought, the ground was graded, implements were given, and already the seeds have been planted, water has been put in, and we're expecting growth in the next few weeks. It was the same school that Minister Barbara Creasy, visited, and she's also very keen to see this program extended to schools throughout the country. The advantage of that is, if the garden is well looked after, we won't have the problem that we had during COVID-19, that when the schools closed because of lockdown, no children got feeding. There was no feeding program. The school shut down and the feeding program stopped. But many principals we met said that if we have gardens, we don't mind opening the schools, COVID or non-COVID, to make food available to the children. So it can serve as a lesson or a prototype during COVID and during non-COVID times.
Dr. Imtiaz Sooliman, thanks for your time. We're going to leave it there tonight. He is with Gift of the Givers.